Hello, everyone, and welcome to this audio podcast. This audio podcast as part of a Spectra Dossier P2. This audio podcast as part of a SZtorm. This audio podcast as part of a Shine Squadron. This audio podcast as part of a Storm and Bostics production. In this audio podcast, as part of this series, as part of this audio in this audio podcast, as part of this audio podcast series, an overview in regard to one of the centric, one of the centric, one of the centric one of the centric one of the centric outcomes as part of one of the centric sort of strategies. So it had been put forward or proposed at least that the Royal Society of Medicine or the RSM had a formal faith where it had a formal faith and medicine or equality and diversity subsection, and with CPD or continual professional development accredited sessions in which healthcare professionals present topics to students, faith leaders, and representatives from organization from organizations representing faith and healthcare. This initiative is is and had also been sort of discussed or highlighted with colleagues at NHS England and the NHS England's Equality and Diversity Division. The Equality and Diversity Division helped to prompt equality and equity, ensuring that healthcare is broadly accessible and that no community or group is hindered. Improvements are made where necessary so that health outcomes across the country are continuously upheld. At a local level, the Bristol Molded Faith Forum or BFFM had aimed to implement educational sessions for health care professionals, patients and carers, faith leaders and teachers with an intrigue and in around a perspective on blood transfusion and solid organ transplantation. That draws this audio podcast to a close. This audio podcast as part of a Spectra Dossier P2, an audio podcast as part of a Shine Squadron, an audio podcast as part of a Storm Robotics production.